Does something correct itself on its own, especially in the case of mental health concerns, which anxiety is. And the sooner that you can step in and learn coping skills and ways to manage it, the better it will be. Or else, if you keep going on, like let's say you notice anxiety in January, and then you let it go in June, and then we get to December and you still have done nothing about it, it's even harder to treat later because you're so used to having anxiety that even when you try to implement some strategies, your brain is already kind of wired toward it. And it takes a little bit more work to undo it.
And that was a really important point to me, because I think women do sometimes let it go, don't they? Or they practice self-help, but that may or may not work.
It may not. And it's nice if I recommend just checking in with somebody, because if you start at the beginning, kind of like what you did, you noticed it at first with the panic attack and you put some things in place right then. If you had not, you may have been having more panic attacks, and then it might have been harder once you finally decided to get some support or some help or to work on it. It may have been a little bit harder because your body, your brain is already so used to this, and it takes a little bit longer to undo it.
Yes. And in that case, I mean, there's lots of different ways that women can approach that, isn't there? There's cognitive behavioral therapy and those types of therapies. I mean, is there any particular approach that you feel works better, or is it dependent on the individual?
Well, what works better is different for everybody, because something that might work for you may not work for me. But in addition to cognitive behavioral therapy, which has a wealth of research behind it for its benefits for anxiety and other mood dysregulations and mental health concerns, I believe that neural therapy works really well for reducing anxiety as well. And it also helps with memory, focus, and concentration issues as well, and a whole bunch of other stuff. But as we talk about menopause, these are two prominent things that come with menopause.
I think some of our listeners might not know what neurotherapy is. So, Dr. J, I'd love you to summarize that.
I'll try not to be long-winded
It's okay.
on it. But with neurotherapy is a brain-based treatment that uses operant conditioning. And so what people who do neurotherapy, well, patients who actually engage in neurotherapy do, it's essentially like playing a video game or playing music or whatever thing is in front of you, whatever stimulus is in front of you, but you make it play based off of your brain's ability. And so it's rewiring the way that the brain waves work, your alpha waves, delta, gamma, on and on and on. It's rewiring how those waves work and function so that things that are too high and ignite way too much stuff like anxiety or memory difficulties, or way too low, sometimes when we start to see things like depression, difficulty like focusing on things, then you can stabilize those brain waves. So it's kind of like being on what do they call, like the Z-scores, where it's between negative 1.0 and positive 1.0. So we're trying to move people towards the middle, which is 0. When it's in negative 1.0 or lower, it's too low. If it's positive 1.0 or higher, it's too high. And so you're trying to move people towards the middle. So in that range of negative 1.0 to positive 1.0. Anything past that range is too high or too low, and neurotherapy helps to train the brain closer to the middle so that the brain waves are operating more stable.
That sounds like a wonderful way. That does make sense to me. That sort of, we don't want to be if we're like overstimulate towards that panicky, anxiousy, which is quite a stimulated state sometimes. And then, as you said, the opposite is, of course, feelings of depression, low moods, which is also quite common in menopausal women at times. But that helped me to understand that a lot better. And it's actually the first time I've heard of neurotherapy, because I'm very familiar with cognitive behavioral therapy. It's extremely popular here in Sweden. It's the go-to therapy.
Oh, wow. It's a big therapy here, too, in the U.S. It's one of the most used therapies, but there's so many other forms of therapy. For talk therapy and beyond, some therapies, like neurotherapy, is a non-talk-based therapy. You may talk a little bit just to assess what's kind of happening, but it's more just based off of the brain waves and trying to move those brain waves towards the middle between negative 1.0 and positive 1.0. So when it's way too high or way too low, putting it in that range.
That sounds like an amazing way forward, because some people don't want talk therapy as well, do they? Or it may not be the most appropriate for them.
That's very true. Some people are not appropriate, and some people don't share very much, but they still want to improve their symptoms. And this is one of the ways that they can do so.
I think that's wonderful. Then there's obviously, and for me, it was mindfulness. And I know because I've heard you and we were together on the Menopause and Mimosa event also mention that. And I'm, obviously I'm a mindfulness practitioner and I love it. And I've worked with a lot of people. I'd love, as a clinical psychologist, how does mindfulness fit into the broader picture of helping women, or anyone for that matter?
Okay, so when you think about, I'm going to focus on just the women, but it does apply to everybody. But when you think about when women are going through menopause, they don't understand their bodies. They're in a state of not understanding kind of like all the changes, which then in turn makes them feel kind of frightened or some anxiety or, like you said, even some depression, because things are changing and sometimes there's some difficulty understanding where these changes are coming from and what they mean for going forward in life. And so mindfulness helps to relax the brain and the body, particularly the nervous system, and keeps you in the present moment rather than being so far in the future, kind of panicking, kind of like a gloom and doom type of feeling. And it brings you to the present and keeps your mind here and focused on what you can control now and what you can do right now.
And I think that's particularly if you have a lack of focus and concentration, that can be a really helpful way to keep anchoring you. Yeah. And I know for me that when I have had anxiety, and I've had quite a lot of clients who do, it helps them to kind of, it's a bit like a circuit breaker sometimes, I would say, that's how it often works. You're feeling these anxious moments and then you kind of practice mindfulness practices, which are appropriate. And it's like they come back into the present moment and the brain kind of calms down.
Yes, it calms the brain, especially for anybody who has anxiety-based symptoms and the focus and concentration. It helps to bring you back into the moment. You feel calmer, and when you're calmer, you can think more clearly.
Yeah, that's very, very true. And I know that you've talked a lot about the importance of self-care, and maybe you'd like to share with the listeners a little bit about maybe some self-care strategies that you feel are particularly helpful for women.
I think self-care is a must. So I'm going to start with that. Yeah. And pretty much kind of like what we mentioned earlier in our conversation, women, we just give so much of ourselves to everybody else. And we leave ourselves for last, or we will put ourselves on the back burner. But when I work with women, I don't care what phase of life they're in, young and old women, even young teens, I really try to stress the importance of self-care and taking some time for yourself. We've all heard that analogy of you have to put the mask on yourself first before you can help other people. And that's what self-care does. And particularly for women and moms, I say pencil yourself in like you do everything else. I don't know if you've met these awesome moms out here who they have schedules, they're color coded. They got everything on the schedule, right?
Yep. It looks really tough and you wonder where they are. It looks
tough and they know where to be at this minute, on this day. They got the schedules so together, but they never have themselves on the schedule. So you have to pencil yourself in on the schedule like you would any other appointment. Appointment for your kids, an appointment for your doctor, an appointment to go volunteer and help somebody. Put yourself on the calendar for time just for yourself like you would any other appointment. And then do whatever it is that brings you some joy. So for me, I really like and recommend things that will bring inner peace and keep us grounded, or kind of like we were talking about earlier, slowing down the brain functioning. So I recommend doing some meditation, doing some yoga, doing some deep breathing during your own self-time. But not all ladies like that. So you can even do some things where you're just paying attention to yourself. Have a phone call and connect with your friends. Do some art. It's very good for the brain. Listen to some music. Really good for the brain. So you can do whatever it is that kind of brings you joy. And nap.
I like that.
Nap. Get some rest. So it can be a number, like the list goes on and on and on. But taking time where you don't have to focus on anybody else and you just do whatever your heart desires in the moment.
I love that. And I think that is probably my number one thing to tell women to do, is to make this time for themselves and schedule themselves in and do whatever. And I love that you mentioned things like art and music, because you really focus in the moment, don't you, when you listen to music, or you do something like, I think I was saying to a friend, well, what about knitting or macrame? You're just doing something very different that you wouldn't do in your job for most people.
Yes, and it has to be different from your job. Like, that is a must. People, I love doing this, okay, but it's still work, right? And even things like gardening, or I recently talked a journalist and said something about